Hi, I'm Rebecca, and this is part two, the company. So today's topic is Regenereyes LLC and the parent company, manufacturer, Regenerative Processing Plant LLC. Now, I know the things that I have been sharing are shocking. They should be. I know an awful lot of people, patients and doctors, are struggling to wrap their brains around the seriousness of some of the things that we've been saying. I don't really expect anybody to make this 20-minute transition from thinking you're dealing with a normal company to believing the sort of things we're saying about this company. That's just not going to happen. And it did not happen like that for us, that's for sure. I did not wake up one day and say to myself, oh dear, what a terrible, great, big, bad company. I think I'll tell everyone I know. It was a long, complicated, intense, stressful process. And for a very long time, it was terribly difficult to believe the evidence of our own research, no matter how thoroughly it was all confirmed. We struggled. And today, I want to share how my understanding of this company changed and why, and how one little red flag grew and multiplied until I had to ask myself, is there anything at all that I now trust about this company? So up until about 6 months ago, my personal interactions with this company were minimal. As far as I was concerned, it was just this thing that was sort of out there on the fringes of the dry eye world. In my head, I had this kind of low-grade red flag associated with them, though. And here's why. So every now and then, someone in the dry eye community, we're going back, 2017, 18, 19 here, somebody would reach out and ask me what I thought of Regenereyes or whatever name it was going under then, or one of the other drops like this. And then this thing would happen. I'd go to the manufacturer's website and I'd read. And I'd say to myself, that's weird. That doesn't make sense. At the time, I did not know anything at all about the regenerative medicine industry. But the thing that always bugged me was the lack of clarity about their regulatory status. It just so happens that I know a fair amount about how eye drops are regulated. At the time, I didn't know anywhere near as much as I do now, but I did know something. So I'd reach out to the manufacturer and I would ask what their eye drop's FDA regulatory status is. And I'd either get no answer or I'd get an answer that didn't make sense. Now, when you ask a drug manufacturer, an eye drop manufacturer, if you will, big or small, when you ask them certain basic questions, you should always get a straight answer. Question number one, what's in it? Answer is simple. Here's the active ingredient. Here's the vehicle, the dilution factor, other ingredients, if there are any. Question number two, is it FDA approved? Now, if it's a prescription drug, the answer is yes. If it's OTC, the answer is a long, tedious, confusing lecture about how OTC compliance works that you may or may not understand. But the answer is never no, because if it's not approved, you're not selling it. The answer is also not misdirection. Now, with Regenereyes, the answer just always seemed to be some form of misdirection or obfuscation, and that's not normal. Anybody who has the wherewithal to manufacture a drug hires the consultants, they learn the rules, they learn how to explain the rules. This was a red flag. But at the time, it was more of a weirdness. I don't get it red flag. It was not a, is this stuff safe kind of red flag? I mean, I never went there in my head. Fast forward to 2022. Sorry, it's early here and I'm still on my first cup of coffee. Everything changed for me the first time I actually got some Regenereyes and held it in my little hands. Just looking at it shifted everything for me from that's weird to you've got to be kidding me. There is something seriously wrong here. I'm not going to get into product details too much till the next video, but broad brush, the packaging of this product made me question the company's transparency in a big way. Example, there's no ingredient list. Well, actually, it does have something pretending to be an ingredient list in the 3-point font insert, but it isn't actually an ingredient list. Now, who hides their ingredients from their customers and why? There is nothing about a biologic that makes hiding ingredients okay. You didn't get to be a black box just because you're biologic. If it is placental proteins, which is what they told us, or amniotic fluid, which is what their patent says, or glycerin, which is what their OTC listing that they somehow snuck in there with the FDA says, then you still get to be told the active ingredient. There's still a specific concentration. There's still a vehicle. Is it water? Is it saline? Whatever it is. And there's still the potential for additional ingredients. So we got a transparency problem. Next, the bottle made me seriously question their competence. I'll say that again. When I first held a Regenereyes bottle in my hands, opened it up, looked at it, it made me seriously question, are these people competent to safely manufacture any eye drops at all? Now, we have a detailed teaching video about these bottles, and many of you have already seen that, and we'll cover some highlights in my next video about the products, but the bottom line is, it's just flat out the wrong bottle type for a preservative-free eye drop of any kind. That's a very easily verified fact. Everyone in the entire industry will tell you that's wrong, and they'll tell you why it's wrong, and they'll tell you why it matters. These are not young innocents that just missed a step. This is an enormous red flag. So as I said, handling the products made me start thinking differently about the company. We got transparency issues, we got competence issues. And that was the motivation that I needed to start really researching and talking to more people. So my next stop was the FDA. And my very first interaction with the FDA forced me to question the company's intentions with respect to the very most basic legal compliance. The FDA's first email to me was astonishing. I sent them concerns and questions. What I got back was the opposite of what I expected. First of all, it was fast. It was thorough. It was technical. It was specific. They went and reviewed the manufacturer's website. They were very engaged. They used very strong language about unapproved regenerative medicine drugs made from the types of materials this company is talking about. They used words like illegal. They urged me to educate our community, which we're trying to do. They gave me articles to help. Bottom line, the law requires that a drug like Regenereyes must be approved before you start selling it. Failure to comply with drug approval processes is not like, oops, I didn't file the right paper in triplicate. It's more like, gosh, I chose to skip 4 years of clinical trials, which could have established whether this is safe and works. If you have a drug that requires drug approval and it isn't approved and you're manufacturing and selling it anyway, the FDA has some technical legal terms for that, but for public consumption, they just call it illegal. You can imagine the word illegal might have affected my opinion of this company just a little bit. Next, a really pivotal turning point for me. Because honestly, even after all that, I was still like, am I really seeing what I'm seeing? It was finding out what the company says when you ask about their approval status now. Now that I talked to the FDA, now that I know for sure, and then went back and asked. I mean, at that point, I was done. I was so done with this company. There's a lot of things that we found that were staggering, but this one was the one that did it for me because they are just so blatantly lying. Now, if you're going to mislead people effectively about your drug approval status, you don't do that by accident. If you want it to work, you have to work at it. You have to write scripts for your salespeople specifically so that they have the right tools to deceive or mislead customers in effective ways. You have to put some effort into figuring out which kind of lies seem to be the most plausible to patients, to doctors. So how do we know what lies are being told? Well, very simple. We called and asked more than once. And we asked other people who asked. I say it was simple. But still, for us to become fully confident that everything they were saying really were lies, really were misdirection, and weren't actually some obscure loophole that we just hadn't figured out yet and that the FDA just accidentally forgot to tell us. The research went on and on and on. My ophthalmologist partner was living and breathing the code of federal regulations for weeks. You can see the fruit of her work, by the way, in our video library and in the summary document that we pulled together for eye care providers. There is a ton of work that went into that. The funny thing is, the FDA told me everything we needed to know way back in the beginning. I had this long conversation with a person in the biologics division. There's this thing called the Office of Jurisdiction, and it's their job to know what's their job. This is in CBER, the biologics division. So they figure out who has to obey their rules. That's the place you go when you want kind of answers I wanted. Anyway, we've had lots more interactions with FDA since then. But like I said, they told me all of this the first time around, but it was just so hard for us to believe that a company could lie and deceive this brazenly, lie to this many people for this long, and nobody does anything about it. I mean, it's just not easy to wrap your brain around that. Took me a long time, really long time. It'll take other people a long time. Although I have to say, now that we have spent a few months trying to do something about it, I fully appreciate now how difficult that is and why no one else has till now. By the way, if you want to know more about the specific lies the company tells about their FDA approval status, feel free to call and ask them. We have a video presentation called Biologic Eye Drops, Clearing Up Misconceptions. It outlines some of the things that we've been told. Personally, they told me it's regulated like a bone or tissue graft. That's one of the most successful lies, actually, because people make the leap from amniotic fluid to amniotic membrane. Is all amniotic, must be regulated the same way. They told my assistant it's not a drug, so it doesn't require approval. Excellent. They told a university friend of mine that it's considered a cosmetic. That was pretty amusing, really. I actually remember the sound of this gal at the FDA chuckling over that one. This is a company that tells whoppers about important things. I had said in my last video I was going to tell you who they are, where they are, and some spicy highlights of their history. There's lots of spicy stuff out there. A fair amount of it made me think even worse of them, but some podcaster can dig all that up someday. For me right now, that's just all extraneous because the real issue boils down to trust. If a company fails the trust test badly enough, there comes a point where there is no aspect of making it, sourcing the components, manufacturing, bottling, selling, marketing. There's no aspect of it that I can personally trust them for. Safe sourcing and handling of biologic materials without any accountability to anyone. Don't let them fool you about being inspected, by the way. They've never been inspected as a drug manufacturer. I was actually recently at a conference watching a presentation about all the reasons to be worried about inadequate testing of biologic materials in the regenerative medicine industry. This was a National Eye Institute sponsored session at ARVO a couple months back. It was fascinating, and it put me over the edge in my level of worry for our community. And I also became very concerned about the fact that our eye care providers are clearly not prepared to identify these types of red flags and protect us. I'm not saying that to dish out any blame. I'm just identifying some troubling realities. So this is how I personally came to dare to suggest publicly that other people besides me should be questioning whether they can trust this company. Based on our research, I do not personally trust anything whatsoever about Regenereyes or regenerative processing plant. So that's all for today. In my next video, we're going to look at the products. The few things we know, the many things we wish we knew. So your homework is go to the watch menu on biologiceyedrops.org and watch FDA drug approval for biologic eye drops, part 1, and meet the snail. Bye for now.